They're the dimples on your legs that make you cringe. We're talking about cellulite. Now there's a way to attack cellulite from underneath the skin in just one treatment. Dr. Edward Bednar from Bednar Cosmetic Surgery joins us to talk about Cellulaze. And Patty Shoemaker is a patient. She's also here. Thanks to both of you for joining us today.
Thank you.
Let's start with you, Dr. Bednar. Cellulite, what causes it? I mean, I think most women seem to have it, correct?
A lot of women do. I mean, it's a congenital abnormality, and really there's anatomical reasons that it does occur. So there's very little you can do about it.
And even thin women will have cellulite.
Yeah, you can be thin, you can be good about your diet and exercise and still suffer from it, without a doubt.
Okay, so tell us about this magical thing called Cellulaze. What is it? What does it do?
Well, it's not so magical. It's a minimally invasive procedure. It is still a surgical procedure, but we do it under local with some sedation. And you're seeing marking here, hills and valleys. You take care of the hills and valleys by marking them with the red and the green markers.
Lots of hills and valleys.
That's right.
Yes.
And what you see here is that the anatomical characteristics of cellulite. And the hills and valleys are treated by placing that laser below the skin and releasing and taking down some of the fat, which takes care of the hill, releasing the fibrocepta, which takes care of the valley. And then what you do is you turn this laser up onto the undersurface of the skin, and you laser that, and that will deliver a certain amount of energy that thickens the skin over time. So with time, we're going to find that skin thickens up. You can see this is how it heals. This is what we find on our studies. But here's a before and after, and this is indicative of what Patty's had done right here.
Oh my goodness, those are remarkable before and after pictures. How is this different from other treatments that we hear about for cellulite?
Well, the other treatments really didn't give us this kind of result. It didn't give us longevity. It didn't give us what we really wanted to see was more of some kind of permanence to the solution. And we never treated all the anatomical components. This right angle firing laser makes it possible.
That is so amazing. Okay, Patty, so you had the treatment.
Yes, ma'am.
Tell me about it. Are you pleased with the results?
I'm very pleased. I'm a month in. I could tell a difference in the first week. I guess, I turned 33 about a week ago, so it was kind of a treat to myself, and no matter how in shape I was, I could not get rid of the problem. So this was an easy solution for me because there was very little downtime. I had it done on Thursday, Friday I was doing office work, and then I was really up and at it on Monday. So I'm very pleased. I'm very pleased with the treatment.
And are you talking about cellulite right on the back of the legs? Was that?
Primarily mine's located back of the legs. A small portion. I mean, no matter how in shape I was, I could not get rid of it. Even at my fittest, it was still there. So, turning 33, I was like, why not? I saw it on TV, and I was like, let's give it a try.
And Dr. Bednar performed the procedure for you. How soon after? Patty mentioned noticing results right away, but you say the results get even better over time?
Over time. That skin thickens up. You get some collagen formation from placing that laser on that undersurface. So the 3 months, 6 months, and even up to 12 months, you can see continued improvement. And we've got patients out several years now in the studies, and it's remained stable. So we think that we've got a real stable solution to cellulite. Not maybe necessarily a lifetime solution. We don't know whether things will have to be repeated somewhere along the lines, but it's a revolutionary kind of procedure. It's sculpting. We've talked about the artistic side to plastic surgery all the time. This is another sculpting procedure, and I think the better you are at sculpting, the better you're going to find that you can smooth the skin surface.
That is so great. Does it hurt?
She's not aware of anything. She'll tell you that she didn't remember anything.
I can't really remember anything from it, honestly. I remember my mom and I had a great lunch that day. I went home, took a nap, and really very minimal discomfort. That's all I'll say. I mean,
very good. That is great. And again, one treatment. One treatment.
Well, single treatment. That's right. And some people will break the treatments up. They'll do the front side of their thighs maybe in one treatment. Some people will do the back side, or they'll combine it. So it just depends on what the patient really looks at as their priority. And you can, as I said, you can do it at any time, front, back, to what area.
Very good. Cellulaze. For more information, visit drbednar.com. The website there on your screen, drbednar.com. Also, Dr. Bednar is hosting an open house to learn more about Cellulaze. It's on June 27th. It is from 4 until 7 o'clock. You can call 704-366-6700. Again, 704-366-6700. 6700 to make your reservation for that open house to learn more about Cellulaze. Again, that's on June 27th. Thank you so much. I think you're going to be getting a lot of calls. I appreciate that.
Thank you.
Thanks for being here today.